Bismillahirrahmanirrahim. In this second video of site-specific regeneration, the liver tissue regeneration is discussed. The liver is the body organ that has got massive regenerative capacity even after resection or after acute injury. The liver, its all cells are in cell cycle phase G0. And the liver regeneration is by the process of compensatory hyperplasia, not true stem cell driven regeneration. The regeneration of the liver is governed by a kinase cascade that is a hippo pathway. And once the normal ratio of liver to total body weight is attained, the regeneration of the liver stops. After acute chemical injury or fulminant viral hepatitis, if the scaffold of the connective tissue, vasculature, and bile duct are intact and there is massive hepatic necrosis, there will be regeneration of the parenchyma, and the normal form and function of the liver will be restored. If there is chronic injury or viral hepatitis or alcoholism, then there is presence of broad collagenous scar in the liver, and these collagenous scars that developed within the liver parenchyma, as happens in cirrhosis, there is presence of these regenerative nodules. These regenerative nodules, they lack the normal architecture of the liver or the central vein, and they expand to obstruct the blood vessels and bile flow outside, and there is architectural disarray, and this disarray of the architecture will impair the function of the liver, and hence the hepatic insufficiency develops. This image illustrates the mechanism of regeneration of the liver, showing how hepatocytes re-enter the cell cycle after liver injury or partial hepatectomy. There is a priming phase. In this priming phase, after liver injury, there is presence of this TNF, and this TNF this environment, uh, TNF causes the release of interleukin 6. Interleukin 6 act on quiescent hepatocyte in G0 phase and prepare them to transform or enter into G1 phase. This step is called priming, making hepatocyte responsive to growth factor. In next phase, that is the proliferation phase. In this proliferation phase, the growth factors are required to drive hepatocyte proliferation, and epidermal growth factor, transforming growth factor alpha, hepatocyte growth factor EFGR are required. This epidermal growth factor and transforming growth factor, they bind to epidermal growth factor receptor, while hepatocyte growth factor bind to the specific receptor, that is MET. Then these signaling pathways, they push the cell or hepatocyte from G1 into further cell cycle phases, leading to proliferation of the cell. As a result, more hepatocytes are generated to restore the liver mass. So the final outcome is successful restoration of liver volume and function occur without scarring if the injury is acute and the stroma remains intact. So to summarize, the Kupffer cell, they secrete TNF that causes the release of interleukin 6. The interleukin 6 is responsible for the priming, and after priming the growth factors are required, and these growth factors such as epidermal growth factor, hepatocyte growth factor and transforming growth factor alpha, they are responsible for hepatocyte proliferation. So hence the liver is regenerated. This is a histological image of cirrhosis of the liver that is stained with Mason's trichrome stain. Here the key findings of this image are these pink red areas. These pink red areas, these represent the remaining viable hepatocytes, that is the remaining liver parenchyma. They are arranged in regenerative nodules. These are the regenerative nodules that are islands of regenerating hepatocyte that have lost their normal lobular architecture. While these blue areas, are the dense collagen deposition region that are areas of fibrosis. There is extensive fibrous septi presence that divide the liver parenchyma into nodule. This fibrosis disrupts normal hepatic blood flow and bile flow and architecture. So this liver parenchyma is separated into multiple rounded regenerative nodules, hence impart it a nodular appearance. And this nodular appearance is due to presence of uh, these fibrotic bands that separate these regenerative nodules. So this is a hallmark of cirrhosis. There is no central vein, and portal tride are either distorted or absent in their usual position. So, and the orderly hepatic cord that are placed normally in hepatic cords, these hepatocytes are placed in hepatic cords. They are arranged in disorganized pattern. So, liver cirrhosis, either micronodular or macronodular, depending on the stage, is characterized by the advanced scarring, and the common condition that lead to this morphology are chronic viral hepatitis, alcohol, and non-alcoholic steatotic hepatitis. So this progressive fibrosis disrupt the function of the liver and eventually lead to hepatic insufficiency. Thank you for watching this video. If you have any question, please write in the comment box.